Thank you so much for joining us today. So I'm Priya Mathews. I'm a cornea specialist currently practicing in Florida in the United States. I was one of the recipients of the ASCRS Young Eye Surgeon International Service Grant Awards. Dr. Phetsamone Indara, and he lives in Laos. And he's one of less than 30 ophthalmologists in the country with a cataract backlog of 50,000. Today, I'd like to ask you a few questions.
Yes, please.
Starting out with number one, why did you decide to begin humanitarian eye work?
Okay, thank you very much for your good questions. So the first, for this I do for me and for my love for this job, and I like this job. I am proud with my ability, to help blind people, and very happy to can do that, And the third, the most blind people are poor. They live in the remote area and allow in very limited the healthcare in the district or in the remote level. So, and many blind people could not come to the hospital. So this is very important. We can organize the teamwork to healthcare in around over there. And what I have done, and I help the blind person to see better, then take me very happy of my life,
Yes. Well, what an impact you've had already.
Yes,
it must be so rewarding. So I know you've been involved in many programs and national strategies in the past few decades, and I'd like to know, how do you think that these programs have really shaped and had an impact on ophthalmology or eye care in your country?
There's because for this program, I take much time for this program already. I have been working for the eye care or eye health for 16 years.
Right.
And the satisfaction is in know that I can impact blind life, blind people live, and I can transform life by the giving their shine is better. And sometimes I have to contact to the community and build important relationship, establish trust with the local people in remote area, and join with the program for the prevention of blindness. So this one in this program can improve the strengthening for the eye care in Laos, and to be the sustainable in the future too, really, so that in very important too. And also this program in the benefit for the people who blind, and have access to healthcare or to eye care to improve the vision. They can work and they can have a good life in the future.
Absolutely.
Yes.
That's wonderful. What part of volunteering do you find the most rewarding?
Oh, so that is very important, it's good to be a part of the program to decrease number of blindness in Laos, and improve the strengthening it eye care in Laos too. And the one more is doing good for the author and community, especially who blind are waiting. So, and increase my ability, confidence, esteem at my life, satisfaction, So, and the last one more, it give me in a success and feeling pleased to this program,
What do you find the most challenging? Because as we know, humanitarian work doesn't come without its downs as well and challenges. Which part do you find most challenging?
So that's one, everything is running well, everything perfect. But however, we could not without the most challenge, So the one in I have worked with the commitment, no time to take care of my family, and there is a lot of work to do. But sometimes I feel like that it's why never the end of this work. But however, I love, and I would like to do the continue. And the third challenge in the work we have to do the teamwork, but in Laos it's a limited the ophthalmologist limited the team to join together. I try to invite everyone coming, but not easy to do that. So, but the four in almost the project or almost activity, we only have get provide and support by INGO, and we limited funding from the Lao government. So input with for the technical or the teamwork or the human resource is quite limited in Laos, Right. This one is a big challenge in Laos. So, however, we try to plan the national plan in the future. We would like to share, we would like to join and continue to do this program in the future to do the best we can,
Yes, I'm sure it's a journey, but I'm sure it's going to continue to improve with time and persistence.
Yes, that's right.
Overview of currently what you're working on and what you're envisioning in the future.
So in the future, so it's we have to continue to the eye care to take care the people in the outreach. For example, for the mobile eye care, very important in Laos, because look like the number, the person coming to the hospital is a very low number, and the number almost the blind people in the living in the countryside, and the poor people is more than 85%, so they could not come to the hospital. So we have to continue to the mobile eye camp. It's important for us.
Right. So do you work with the government then for to develop these initiatives?
Yes, that's why I am ophthalmologist, work with the government, work with the government hospital. And however, I have to save time to work to take care of the outreach too,
Of course, of course.
Yes.
And so my last question is, for young ophthalmologists like myself, do you have any advice for us as we're starting our career in humanitarian eye care work?
No, so from my experience and my working for the 16 years. So the first one, which to be a good ophthalmologist, or good eye doctor. The second, we have to like or love our job. Mm-hmm. And the third, we don't think, or we don't use the person eye to practice. We have to think that eye is my mother eyes, We have to be careful in very important. That's one first. And the four we have to do by working by teamwork. We could not do alone. We have to share experience together. And the next, we can join together to help and take care the many bright people are waiting for. So.
Such beautiful pearls of wisdom. Thank you. Thank you. So Dr. Phetsamone, thank you so much for what you've done for the people of Laos, but also for inspiring young ophthalmologists like myself all over the world, to continue the work that you have started, and for encouraging us to think of new ways to reach those individuals, who may not have access to healthcare. I think you've really done a wonderful job in reaching those people, and we all look forward to hearing how you'll continue to make an impact for the people of Laos. So thank you.
Yes, and you are welcome. And I wishing that for the next time or in the future we can join together.